Hi, my name is Sonia, and I am a registered nurse. I am a psychiatric nurse. I am a behavioral health nurse. I am a mental health nurse. Take one, pick one. And I'm here to talk about mental health nursing from a nurse's perspective. No, I'm not a doctor, but doctors spend 15 to 30 minutes with a patient who suffers from mental illness, while the psychiatric or mental health nurse spends 8 hours, 12 hours, or even 16 hours with individuals who suffer from mental illness. And why are we not having this conversation about mental illness? Is it because of the labeling? Let's look at Hollywood. Hollywood portrays people with mental illness in such a negative connotation that it's no wonder why people are afraid to get the help that they need. And let's look at the media. You hear the media talk about mental illness for about 2 minutes. You hear lawmakers talk about funding and research for mental illness for about 2 minutes. The topic goes away, and then you don't hear about it again until there's tragedy that occurs in a school or a mall or a movie theater or at someone's job. And let's talk about the mental health patient. People are hurting and they are afraid. The mental health patient knows that something is wrong and they don't necessarily know how to get the help that they need. And is it because of labeling? Or is it because they may think that their loved ones may reject them if they learn that there's a mental illness involved? Or they may be afraid to admit themselves that they have a mental illness. And let's talk about the families. The families who have individuals who suffer from a mental illness. The families may know that something is wrong with their loved ones and may not necessarily know the signs and the symptoms that go along with that mental illness. And the family may not necessarily know where to get the help that they need for their loved one. And let's talk about the friend that sees changes, personality changes, mood changes, isolation, avoidance. Let's begin to have that conversation. People go to the doctors and they talk to their doctors about their diseased heart or their diseased kidney or their sick lung or their diseased liver. Well, mental illness is nothing more than a diseased brain. It's an illness of the brain and is no different than having high blood pressure or diabetes. It's still an illness. But there's not a lot of attention and a lot of focus on people who suffer from mental illness, and a lot of individuals are hurting. And as a nurse's first job is to advocate and then educate. So we're going to start having that conversation because there's a lot of money being spent on research on high blood pressure and diabetes and obesity and cancers. But there's not a lot of money and research being spent on mental illness and how to prevent mental illness. So we're going to start having that conversation. So subscribe to my videos because this is only the first video. And we will start having that conversation to bring awareness so that people can hopefully stop hurting. And in the meantime, let's begin to take care of ourselves and each other. Thank you.